Follow along to test your knowledge of the different types of heart sounds. We know S1 and S2 are normal heart sounds, and generally S3 and S4 are abnormal heart sounds. S1 is when systole occurs, so this is when the aortic and pulmonary valves are open, allowing blood to flow to the body. S1 is the sound of the mitral and tricuspid valves closing. And so we know then that S2 is when diastole is occurring, meaning the heart is filling, so the mitral and tricuspid valves are open to fill. So this is the sound of the aortic and pulmonary valves closing. A little memory trick I use is I like to think of the S in systole for sun as in energy, to remember this is when blood is actively pumping out, and then think the sun comes first and S1 is before S2. S3 and S4 are usually sounds of something abnormal occurring. In S3, this is happening right after the AV valves open when the heart is supposed to be filling, so this sound is from rapid ventricular filling. S4 happens during atrial kick, while the atria contract to push blood into the ventricles before S1 when the ventricles contract to pump out the blood. And this is due to blood forcing into a stiff ventricle. Let me know if you got all these right in the comments below.